Good afternoon, everyone. My name's Hugh Stevens. I'm the head of marketing at HotDoc. I've been working in the sector for quite a few years in the health space, and a lot of this is actually based off a presentation I gave to a series of clinicians and communications professionals in the US at the Mayo Clinic late last year, I guess. But it's an area that's, I think, quite important and increasingly important, but also something that for a lot of clinicians and a lot of medical practices, this isn't a core part of your work. Your website isn't obviously part of providing great care to patients, but at the same time, like every other business, it is becoming a really important way in which we make sure that you're able to be sufficiently accessible and available for patients and the general public when they need information from you. If you have any questions throughout the webinar, feel free to just drop a question in the question box. I can see a question there already. Yes, absolutely, the webinar material. So after the webinar, we always publish a recording as well as a copy of the slides. So that'll all be published afterwards, usually late this week or early next week. And you'll all receive an email with a link to those materials when they're published. So what we're going to cover today, first of all, what makes what I would call a good modern website, and that is a bit subjective. But really, I guess what you need to focus on is, what does your audience want to see? So what do patients want to be able to see from a good medical website? Secondly, some sort of basic information on how Google chooses search results. Now, Google ranking and search engine optimization is an entire industry all to itself, and there are certainly specialists who have studied it for years and years and years and have far more knowledge than I do. But at the same time, you can kind of get, with some basic principles and things like that, you can get yourself, 80–85% of the way there without necessarily needing that degree of knowledge. And so, that sort of is the level that we're going to cover, because really, that's all I worry about for the websites I've, really built. And that's really all you should be worrying about as well. And we'll talk obviously about how you can then optimize your website, and also how you can use, in particular, HotDoc bookings. It's part that we've baked in some great sort of tools and things that you can use to help improve your search rankings. Oh, apparently I've lost sound. Am I dropping out for anyone else? I've got one person saying I'm dropping out. Oh, back again. Okay, that's right. It might just be a bit of a glitch. Then we're going to talk just very briefly at the end about, what do you do in the situation where, you really have a problem, and, advertising and what those choices might be for your practice. So what really is a good website? Now, it's really important to say that that's entirely subjective, and what I think is good will be different to what you think is good, and particularly when you start talking about, what the design might look like in particular. But really the questions that we want to think about is, who is going to be using your website? Now, obviously a very clear one is patients. They could be new patients, they could be existing patients. But in medical practices, we also have other stakeholders. So we also have things like specialists looking for a referral, or even things like PHNs looking for information about the practice that they might need for their purposes. So it's a really good opportunity to think about, we call this in the industry, building personas, or, kind of profiles, I guess, of common people that will be using the website. But, patients are obviously the number one, but it might be worthwhile thinking about the other people who might be using your website and, and what is it they want. So then the second question you ask about each of those people is, what do they want to find or learn about? Now, with patients, we know that that's generally, they're looking for contact information, they're looking for opening hours, they're looking for location, they're looking for the ability to book an appointment, maybe they're looking for a cancellation policy or a fee schedule, or things like that. And that kind of ties in with why they're really visiting your site. Now, I'm going to kind of use, and I'm going to kind of come backwards and forwards this, but I'm going to use this website as an example. It's called Demo Road Medical Center, because I'm a very inventive person. And this is pretty much just a template. I sort of built this very, very quickly yesterday, so you can see a lot of the text is all still garbage text. But we're going to kind of use this as an example on our way through. And you can see one of the things that I've really tried to focus on, or was really focused on this template, which is why I chose the template, is it's got these segments, this segment down the middle that has a very easy way for the patient or the person, the visitor, to be able to find the phone number, an easy button to book an online appointment, an easy way to see the address, and the opening hours are right here as well. So I think one of the things I really like about this, this website in particular, and this template that I've used, is that they're really upfront about that right in the very home page. And I think that's a really good example of building something that is going to be quite clearly useful. The area that I'm probably missing is something about fees. There's no menu item here for fees, for example. But I'd need to think about whether or not my type of patients that I usually see, whether they're going to be the kind of people that are going to be very concerned about whether the clinic is bulk billing or private or a mix and things like that. So what are kind of the common complaints that people have? The first one and the biggest one is that they can't use it on a website, or they can't use the website on a phone. And that's the thing, like a lot of websites now, they're a bit older, but when you try and use them on your phone, it's practically impossible. And as you can see, the way that a good website's designed now is this thing, they call it responsiveness, and that's where, when you can collapse it down to the size of a phone, and you can do that by just resizing your browser window. When you collapse it down to the size of the phone, you should still be able to use, the basic features of it, and certainly be able to do things like find the phone number, find the address. They're really, I guess, those core activities you need to make sure are able to be done on a phone as well as on a desktop. And we don't often, you don't often necessarily check things on your phone. And so it's really worthwhile, having a quick look at your own website. And you can do that, on your own phone, obviously, or you can also do that on a web browser like this. Check things like menus that make sense and things like that, and still operate on an actual phone. So the second thing is that information, and I've listed kind of what I think is the main information that patients are going to be looking for. One of the things I wanted to highlight is this idea of public holidays, and we know that what happens in a long weekend, and you don't know if the gym, your kids get sick, and you don't know if the practice is open on the Monday of the long weekend. Now, you're not necessarily going to be able to have a big segment in this little opening hours paragraph that says on the long weekend. But for example, that's the kind of thing that can be very useful for things like news sections. So some of this news section might be, this is all generic template stuff that's kind of public health focused, but you might just have a news item to just say our opening hours over the long weekend or something like that. They also go there looking for doctor names, of spelling. For example, when they're talking to another health professional and they need to say who their primary clinician is. That's the other thing that I think is worth keeping in mind. The other complaint is that it's just not up to date, and it has old information like a phone number that doesn't work, or the old address, or things like that. And that certainly is as well a common thing that we do see, because we all forget about the website when we're doing our day-to-day work. And then the final thing is they can't actually find it. So it's one thing to say, well, if you have the URL, if you have the address, it's all great that you can find all of that, but if I don't have the address, like, how do I look for it? And there's kind of two sides to that, is that you have existing patients who will often type in, or even a new patient driven past a billboard, or there's signage out the front, and they might type in the name of the practice into Google, or you might have patients that are just searching for, medical centre in whatever their suburb is. But obviously being able to find that, and search traffic is really important traffic now, for both that existing and the new patient audience. So the second thing, as I said earlier, is this whole idea of mobile friendliness. Now, that's good in terms of patients themselves. In Australia, we actually have one of the highest smartphone penetration rates. This is from a 2014 survey that found that the smartphone ownership had gotten up to around 90% of the population, which is maybe a little bit high, but certainly it's a vast proportion of people now have smartphones in particular, and obviously they access stuff on the web. But the other thing, and the other important thing to think about, is actually Google actually put out an important announcement around how they do their ranking, and one of those sort of signals that I guess that they use now is whether it's mobile friendly. Now, at the time, and this was in April 2015, at the time they said, well, this will really mostly affect the search results when someone's searching when they're already on their phone. So, the search results when you're on a desktop, they won't necessarily change if you don't have a nice mobile-friendly website. But, as I've sort of said so far, we know that a lot of people are using their phones for these kinds of things. So it is really a very, very important thing, irrespective of that. But we do know that that's part of Google's ranking mechanism, and they've kind of announced that a couple of years back. And then the third thing that's quite recent is actually the secure side of it. So you probably know that, you know, when you go to your bank website and things like that, you have HTTP and then you have HTTPS, and they're different. And in Chrome now, they've got this big green little secure thing versus saying, you know, if it's tries to deliver a certificate that's, you know, totally wrong, it gives you this big red not secure thing. But security is actually now also one of those ranking signals that Google uses. And that's, I think, you know, it's both good for a medical practice to have that kind of thing, just in terms of, you know, medical Health Privacy Act compliance and things like that. You know, while you're not necessarily asking patients for clinical data through the website, it's probably just, you know, a good sign. But additionally, we know that that's something that helps with your Google rankings as well. So that's definitely something that's worth thinking about if you don't have it on your current website, or if you're building a new website, is to make sure you're able to get that HTTPS, you know, SSL security element to it. Usually it's just a bit of mucking around and a bit of paperwork for your IT provider, or, you know, if you use some sort of web hosting company, often it's, you know, you click a few buttons and you pay an extra $24 a year or whatever it is. So it's not usually a total nightmare. You know, I managed to set up this website with that security yesterday afternoon without too much trouble. But, you know, it helps. I'm a bit of a nerd. But, you know, that is very, very important. So let's quickly talk about how Google ranking works. And kind of, you know, this is not necessarily entirely, you know, from Google's public things, and they don't tell you every factor that goes into their rankings. But, you know, a lot of people have worked in the sector long enough to be able to sort of reverse engineer things a little bit and understand how, you know, how it works behind the scenes. So the first factor, and, you know, what a lot of people say is the most important factor, is the idea of this sort of interconnectedness with other websites, so the links that go backwards and forwards. And you might see this described as backlinking, or alternatively link building is kind of the activity of increasing this interconnectedness. And not all links necessarily give that, you know, link juice that you need, so there's also a little bit of complexity in there about that. But the logic, I guess, and the underlying logic of it is that sites that, you know, a lot of people link to are usually, you know, higher value sites. And if you think back to the really early days of the web, you know, back when Yahoo was a thing, or even Alta Vista, you might remember, you know, back in those days, you know, that was pretty much the only way that we could really map the web and be able to work out, you know, what sites were good and what sites were bad. And now it's obviously a little bit more complicated than that. But we do know that this idea of interconnectedness is important, and the type of websites that link to your practice website is also quite important. So, you know, it's quite different getting a link from, I don't know, some a blog that no one reads. That's very, you know, that's not as useful a link compared to a link from, you know, the Sydney Morning Herald. So there is kind of this degree of, you know, the popularity of the websites that's linking to you is also part of that sort of ranking piece. And, you know, you'll see in the industry terms, they call that the page rank of the actual, you know, the website itself. So the second thing, and probably the thing that's easiest to have an effect on, is the idea of relevance of the content. So obviously when people are searching for things in Google, they're usually trying to ask for an answer, or they're trying to find something quite clear. And the more that the content that you have on your website is relevant to what it is that they've typed in, the better that you're going to rank. And that's this principle of what we call on-page optimization. And we'll go into that in a little bit more detail shortly. Then you've got things like, and sort of we're going generally in the list of, you know, less and less important. Then you've got things like the engagement when it's shown in the results. So, you know, when people see that result, how often do they actually, you know, click on that link compared to the other links available? And you've got some things like timeliness. So we know that websites that have more frequently updated content often will rank better in general. So that's the idea of having some sort of news section that does occasionally get updates. It's not to say you need to have a new post every week, but certainly, you know, something like, you know, something that goes up there once a month or something like that would be able to kind of make sure that the website does get a little bit of refreshing and turnover to itself. And that's, you know, that doesn't need to be a long post, you know, like it can still be a 250 or 300 word post that you've put up there. But, you know, timeliness is an important factor. So having a quick look at some search results here. Now I just put in North Sydney Medical Centre because I figured it was an easy enough choice. So kind of dissecting what the Google results look like, you can see the first thing that you see is some results that are ads, right? And you can see that they've got this little ad green widget. And people, obviously, you pay to advertise, and that's how Google makes money. But that's what we call the AdWords results. So AdWords is the Google product that lets you advertise. Then often, not always, sometimes it's in here, sometimes it's on the right-hand side, there are these Google Places results, or the map results, I guess. And that's the same results that you'll get when someone types in the same sort of query into Google Maps, for example. So it's really important that you make sure that your clinic is listed here with the correct information as well, and we'll go into that a little bit later. And then obviously you've got the results that you're more familiar with, which is what we call the organic results. So they're the ones that you're really focusing on. A lot of people will ignore the ads, or they won't notice the ads, or they've kind of trained themselves to ignore them, or they'll at least say that that's the case. But the part that we're, I guess, trying to really impact here is kind of where you rank in terms of this Google Places element and these organic results. Because really, if I'm searching for an exact, the same name as your medical center, I should be able to find your website, somewhere in at least the top 3 results. But ideally, obviously, the top, the #1 result should be your medical center's website. So what I'm kind of pulling a few things out from here is a very simple guide that's been published by Google. It's actually a little bit old, and I'll put a link in the resources to it. But it's quite simple, and it explains things, I think, relatively well. Occasionally it's a little bit technical, but it's quite simple and easy to understand. So that's a good resource to have a look at. So let's have a look first of all at these things that are on your website. Now, the first thing is using unique and accurate page titles. So the page title is this bit here. So this big blue heading, North Sydney Medical Centre, blah, 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 blah. So that page title, Google says that they should be unique, so you can't duplicate them. They shouldn't be the same across your whole website. And it should also be relevant to the actual content that you're publishing. So, for example, my homepage might be, home, and then the name of the practice, maybe even the suburb at the end. And then, a doctor page might be the name of the doctor and then the name of the clinic. So it's okay to obviously repeat some parts of it, and it's quite common to have kind of the name of the website, at the end of the title. But it's important to make sure that they are relevant to the content. One of the big mistakes that we see people make is putting all of these weird abbreviations and jargon in there. So it might be saying, instead of medical center, you might say MC. So really try and avoid that kind of thing, because really, unless patients are actively using exactly the same abbreviations or exactly the same jargon, it's not going to help you very much. Now, the third thing is this idea of keyword stuffing. So in really sort of old search engine optimization world, there was this big idea of, to get that relevance piece of the puzzle, what you would do is you would write these articles or pages that would mention, the word that you're trying to get people to search for continuously. And so you'd end up with this just garbage content that made no sense when a human read it, because it would be the kind of thing like, imagining that you did a page title that was Dr. Jane Smith, GP, medical practitioner, Demo Road Medical Centre, GP clinic, Fakeville, Melbourne, Victoria. And you still do see that kind of content every now and then, and it just reads really wrong and very, very strange. And Google has well and truly since penalised quite significantly, websites that clearly are doing that kind of thing and produce this unreadable drivel. So that's a really important thing to note. That's not to say at the same time that if you know that people are going to be searching for Fakeville medical centres, that you shouldn't make sure that Fakeville and medical centre is in the title. So it's kind of a balance, I guess, in saying that. And similarly, when you have a page about a doctor, obviously having a doctor's name in the title, and all those kinds of things. So it is still important to use the keywords in the right spots, but don't kind of just sort of litter them throughout the website or throughout the content continuously, because that will often just produce a very confusing website, irrespective of whether you do have any benefits for Google ranking. Similarly, you've got the description tag. So the description tag is the sort of grey-black text underneath it, and that's the description tag. And they say similarly, use a sensible description, similar kind of rules to summarize the content of the page. So not duplicated, not stuffed with keywords or other garbage. And then the final thing, just to really reiterate it, is we do know that just copying and pasting the same content, whether it's the content on the page or the content in the title or whatever it is, that is something that Google doesn't like. And so, even with HotDoc, for example, we encourage people to, at least have some minor changes to things like the doctor profile information or clinic information that's on the HotDoc website. There are obviously other things about HotDoc's website that will be quite different to your clinic's website, like it's got the word HotDoc all over it. But obviously just keep that one in mind while you're doing that kind of thing. So the other thing is these ideas of site links, and you can see this practice has quite a sort of smartly designed website where it's kind of got these key segments underneath, and I suspect that's because someone did this quite intentionally. Now, how you get those site links is kind of complicated around things like you sort of submit a sitemap, and even then it's kind of you sort of pray and hope that the Google overlords will discover it and show it up correctly. But if you do see those kinds of things, that's generally where it's from. But if you search the word site, how to get site links on my website's Google results, you'll find some information about that. You can, oddly enough, Google for some advice. The final thing I might mention is also this URL. So in the URL, for example, if I was going to have, I think I've got a slide on this now. So if I was going to have a URL about a doctor's name, instead of having, demoRoadMedicalCentre.com.au/page ?ID = 123. So let's imagine that was the address of my pages. Now that's not, we know from, and Google said this, that that's not nearly as good as having what they call permalinks. So for example, it might say, instead of that, it might say / our doctors and then the name of the doctor. And you can see that, I think, if I've done my job correctly, you can see that in the URLs of this, it has profile. But I would ideally want to change that to, our doctors / Dr. Nick Sims. But making sure that result, that URL is also a way, because as you can see in the search result, the URL matches the name, the thing that the patient has searched, and that's good. If I'm searching for Demo Road Medical Centre, I want demoRoadMedicalCentre.com.au to come up, quite early, and Google knows that. And so having a relevant URL, even just the actual domain, is quite useful. But additionally, those things on the other end of the URL is quite important when people are looking up a particular practitioner's name or something like that as well. Or even, services. So, if I put in North Sydney vaccinations, maybe there's a page on vaccinations that I could discover. Generate and submit a sitemap. Now, if you use a website tool like WordPress, a lot of websites now use WordPress. There are all kinds of plugins that you can use that do this. I've got one linked a little bit later on. That's the one that generally most people use in the industry. That helps you with all of these things, like the names of the titles of the pages and the descriptions of the pages and everything. It has all these little widgets to let you help that. But a sitemap is an important way that you can sort of signal to Google. These are the things on my website that I want you to look for, Google. And then finally, write some new content, make it easy to read and relevant to people. Again, avoid that idea of trying to sort of keyword stuff. But we do know that kind of that new, fresh content can also really help how your particular website ends up ranking. And then the final one, and one that's kind of, I guess, an easy bad habit for a lot of people, is that they don't recommend, and this is both for accessibility purposes. So, for example, if people are people with low vision who might use a screen reading software, or even blind, vision impaired people who are using screen reading software, you should try and avoid using click here as like the text that you're linking something to. Ideally, the text that you actually write that is the link that you click on, that should be really a description of what the person is going to discover on the other side of that link. So if I was linking to an article, I would put the article's, put the name of the article in the text and link the article's name, not, to view the article and then the article's name, click here, only link that click here. So some of those little tips and tricks you'll see in that Google guide that I mentioned earlier. But that, I think, is a good one, and it's one that we actually teach people generally from an accessibility point of view as well, and it also improves, sort of readability of text. Sometimes it can be hard to avoid, but where you can, obviously, it's good to avoid. So that's kind of, I guess, a very brief introduction to kind of the things that you can do specifically on your website. So I might just quickly show you an example of that plugin that I mentioned. So the plugin's called Yoast SEO. I've got a link to it, don't worry, you don't have to write it down. But for example, let's have a quick look at the homepage here. Now I should say I haven't really optimized all of this, and it's designed so it's hidden from Google at the moment because it's obviously a fake website. But you can see here that this particular plugin is called Yoast SEO. It kind of provides me with the ability here to sort of manually edit the actual content that Google is likely to see. Now, they don't always, so if I put in here, the best practice in the world, Google isn't necessarily always going to use your description. It's not always going to use it, but commonly they do, assuming that you've written something that's quite sensible. But you can see this kind of plugin can be quite helpful in being able to sort of visualize what it's going to look like, because it also shows you, if you've got a very long title. I'll just copy and paste this a few times. If you've got a very long title, it shows you when Google kind of shortens it down. So it's very helpful. Very helpful little plugin to use, and quite obviously easy to use on a quite simple level. So then there's this idea of backlinking and link building, and that's, as I mentioned, is about producing links that come back to your website from other places. Now, common places are things like blogs or news, media outlets. Secondly, you've got things like social media, so you've got Facebook, Twitter, and Instagram if you wanted. But also, whatever channels you can imagine to generate some links back to your website. And the PHNs, for example, are a good thing. So things like all those directories that you find from the PHN is often a really good place to make sure that they're listing your clinic. They're also listing a copy, a link to your website, because that's good. Good for you, and it also means that if a patient does discover your clinic through the PHN, for whatever reason, then they're able to click the link right there and discover more about your clinic rather than having to Google the name or call the phone number that's there. Now, a very quick bit about HotDoc bookings. Now, if you're a HotDoc bookings customer, you can talk to support or customer success, and they can give you a quick hand. But the basic important things to do is firstly to set up your clinic website URL correctly in HotDoc. So we have the right website for you. When you're doing your doctor profiles, then it's good to be able to link back and forth from HotDoc to the doctor profile and back. So as an example, if I bring up one of the doctor profiles here, doctor profile, or physiotherapist profile here, you can see I've put a link here, and that link goes straight to the specific doctor page, on HotDoc. And it says book an appointment with Michael, for example. And I should say that on this website or I've designed it so that all of these make an appointment, book an appointment buttons, they obviously link to HotDoc bookings because that's what you want to be able to do. And there are various ways that you can embed that. This is just a simple link that opens it in a new window, but we've got a light box and we've got a widget that you can embed in the page and things like that as well, that hopefully someone's sort of walked you through along at some point. So make sure that in those doctor profiles you're linking back and forth from that specific doctor page, not the generic clinic one, but the specific doctor page for HotDoc. Fill in those doctor profiles in HotDoc bookings. We have, some of our team members are very, very focused on search optimization for HotDoc generally, because we know it really helps the clinic website. Because we kind of set up our side of it to show that the clinic website is the official, source of truth. So, make sure you fill in your doctor profiles. The more stuff you can put in there, the better. Really about, the areas of interest or the areas of specialization. Or similarly, with the clinic as well, the areas that you particularly practice in. And then finally, again, like that first bullet, make sure that you're linking from your website to HotDoc bookings, and the HotDoc bookings is linking back to your website as well. It's an easy way to get a free link to do it. And if you use the widget code that we provide, it sort of automatically does it itself. I've got a quick question that I'll cover while we're here. How do we get the clinic backlink from external providers? Now, commonly you kind of just ask them, and if it's something like a PHN, you just ask them. You know, you can't really just sort of email the Sydney Morning Herald and say, hey, I want a link to my website from your website, please. And like I said, not all. So a lot of news sources now these days, they actually set a sort of little attribute on their links to show that they're not trying to give link juice to it. But I would, for example, make sure that in the National Health Services directory, you've got your website there with the PHN. You've got your website there if they have a website. So it's really more something that, or from my point of view, as a medical practice, that you only have so much time in the day. I would more be focusing on either the really low-hanging fruit, like things like the PHNs or National Health Services directories, or alternatively on social media that you control, or when it comes up, make sure that you go, oh, it'd be great if you could link to my website as well, while you're doing that. So they're kind of the areas that I would focus on. But it is, again, link building is kind of a sub-specialization within this whole Google ranking industry. So there is also a lot of different mechanisms people have for that as well. So the third thing that's really important, and I promise, we won't go too much over time, is Google Places, or sometimes it's called Google Business, is what Google commonly calls it. Now, that's really good because it's good for your general search rankings, but it's also really good because it makes it easier for patients. So these, Google Places listings, they're what comes up when people search something in Google Maps, for example. And you want to have your clinic on Google Maps. And I don't know about you, but when I'm in the car and heading somewhere, and I've just left a friend's place or something, I'll almost always whip out Google Maps to check what the best way is to get there. And so it is really, really important to make sure that you do have that. And the area in particular that we see this being beneficial is when patients are searching for things like medical centres in the suburb name. And so this is the kind of area where, when you start talking about kind of recruiting new patients through search, these are kind of really helpful ways to be able to do it, and it doesn't take too much time to really set up. Like I said, it appears in other Google products as well as just search, like Google Maps. It can include a number of different things, and you'll kind of see the fields when you go through and set it up, like your website, and you can see back in that other example I had, it had the there we go. It had the website as well as the phone number and the address for this particular clinic. And this one in the middle, you can see it even had the opening time. So you can set up opening times, and helpfully now Google has a little sort of flag that they show. So if it's a public holiday, it actually is a little flag that they show there. You might have seen it yourself that says, these times might be affected by Labor Day. So you don't always have to keep them up to date, on a public holiday, for example, because helpfully now they at least warn people that maybe they might have changed. But website and phone number, absolute necessity, along with address, because you need to put an address in. So it's pretty easy. You go to the Google My Business website. It sort of walks you through it all. They kind of call you to verify, or they send you a bit of post to verify that you're legitimate. But it's pretty easy. Click the start button, you get going. The only thing I'll say is that obviously a big part of it is that Google does it so that they can sell you, some advertising. It can be a good way of getting there's these $100 or sometimes $250 free Google AdWords vouchers that they give you if you've never used AdWords before, to kind of try and get you hooked on search advertising. So be wary that they'll probably try and do that. But hey, it's free, and it's certainly doesn't cost you anything, and they're okay if you say no. So there's nothing unreasonable with doing that. So they're kind of our top three areas for you to think about. So that first one was about the on-page information. The second one was the link building, and then the third one were these Google Places or the Google Business listing. They're three things, and particularly this Google business listing and reviewing, your website for things like its mobile friendliness. That's all fairly easy stuff. When you start getting into link building, it can start become a little bit more time intensive. But it could just be a good opportunity to check in the National Health Services Directory that all your information is up to date, which is sometimes something people forget. But they're kind of the things that are really easy, low-hanging fruit to be able to address, hopefully for your clinic. So a couple of really important notes. The first thing is with this whole Google search ranking thing is, it's not some magical overnight silver bullet that will skyrocket you to the first place in the results listings. If there was, then you would get to the first place, and if it was a competitive thing, so if you're looking for car insurance, for example, I'm sure that there's a gigantic battle around, what the top probably 2 or 3 pages worth of the Google search results are for car insurance. So, don't expect magical success overnight, and there isn't some sort of, weird and wonderful trick that all of a sudden will make everything work beautifully for you, unfortunately. Be very careful about some of the expensive specialists in this area. There are a lot of businesses now that are set up to provide, Google ranking or search engine optimization services. And it's not to say that that's garbage. It's not to say that at all. But I have seen a number of people who've ended up on on a retainer with one of these businesses, and they're just not really getting results. Like unless you're actually really getting proper results, and by results I mean patients walking in the door. That's the kind of results you want. It doesn't matter about how many website visits you get and blah, how many patients are walking in the door, how many new patients am I getting. That's what we're really trying to get here. So just be a little bit careful about that, and it is kind of one of those industries that has in the past attracted a lot of sort of shysters. So that's kind of my general warning about it. Obviously, some keywords or searches will be much more difficult than others. So if you're in a country town, it'll be a lot easier to be able to kind of own those Google search results. And if you're the only practice, obviously, it'll be much easier to own those search results than if you're in the Melbourne or Sydney CPD. That will be harder. So keep that in mind, and there are some tools you can use to kind of estimate the difficulty of different keyword combinations as well, and I'll show you in the links. They'll provide that. Ideally, though, you want to make sure that your clinic website is always first in the results when you're searching for the clinic name itself. And that I think is really useful, just simply by nature of that's what patients want to be able to see and find. So that I think is a really important first step, irrespective of all of the worry about people searching for medical practices in whatever your suburb is. So here are some of these easy resources that I mentioned, and like I said, the slides will be available afterwards. Helpfully, I've just seen that this one is busted, but I will check the link, and then I'll make sure it actually works. But here's that starter guide that I mentioned. It's generally pretty sensible. A more detailed one is from a company called Moz. It's a very well-known company that sells some sort of software tools that help people who work in this sector. It has quite a detailed version of things like how people interact with search engines, the basics of design and development for it, how to do this idea of keyword research to understand the competitiveness of different keywords, for example. And it's quite detailed, but still is quite friendly to be able to read. And this is the plugin that I mentioned. It's called Yoast SEO. It's been around for eons, and it's just it's pretty much the thing that almost everyone uses for this kind of for that ability to be able to edit the title and the description and things like that. So if you do use WordPress as your website host or your website platform, that's a really great plugin to have if you don't have a plugin that does that kind of thing before. Obviously, Google will give you all kinds of results and helpful top tips articles and everything else as well, if you're interested in really going into a lot of depth. But there, I think, some really reasonable places to start. So what happens if it's not really enough? Now, you can run AdWords ads if you want. So I showed you those ads in the search results that come up at the top. While I did say, some people have trained themselves away from clicking on them, they're still very, very successful. The reason Google is such a big business is because people do click on those ads, and you only pay. You only pay for when someone actually clicks on the ad. And that was why Google ended up making so much money from the early days, is because it was one of the first advertising channels where you only had to pay when someone actually clicked on the ad. And you've got all these, budget controls and things like that within the interface as well. So you can run ads yourself. You could get an agency to run ads for you. Commonly, that costs sort of like 15% of your spend, and they have a minimum spend of however many dollars it is. But it is actually very easy to do it yourself. And in fact, if you spend, I saw on the AdWords website, if you spend more than, I need to open a new incognito window. If you spend more than $5 a day, I think it is, then they'll actually get on the phone with you and give you a hand. Well, this one says $10 a day. Anyway, I saw it the other day and it was $5 a day. Maybe it's different in Australia. This is an American number. But I believe the Australian number is, you've got to spend $5 a day, and they'll happily, and usually, even if you're not spending $5 a day, they'll usually help you get started. It's obviously in their best interest because it's how you give money to Google. So it is quite easy to do it yourself, and there are lots of tips and tricks and lots of articles about it. But at a very basic level, what happens is you type in the keywords that you want to target, and then you kind of type the content for your ad. It's always best to test a couple of different options, a couple of different sets of wording, rather than just having only one ad. Google has all these magical things that it does to show the best resolving, the ad that people click on the most for the right kinds of search keywords that they're using and things like that. So it kind of self-optimizes automatically. But usually, or I've always said that you do sort of 2 or 3 versions every time. And even you come back in a couple of weeks and then look at which one's done the best, and you might pause the other 2 and then add another different iteration of that as well. So you can kind of work slowly towards it. And the good part with all of this digital advertising is you can stop it when you want, you can start it when you want. It's quite easy to turn on and off the tap. So their recommended minimum is $5 a day. That's the Australian number but they do provide free phone support and kind of setup and things like that, particularly, like I said, because it's obviously in Google's best interest to be able to give you a hand. Like I said, you stop whenever you like. So the other things I want to keep you in mind, just to kind of sum it up, and we're just on time, is don't forget the other basic marketing tools. So things like signage, road signage, or even signage at the local train station, or places that people might congregate. That kind of like traditional local marketing is still really, really valuable. Similarly, things like having a nice reception area that people can see, and making sure that the lawns are done, and all of those kinds of basic things as well. Just trying to make the practice look like somewhere that people will want to actually go to. The third thing that we don't necessarily see a lot of generally in medical practice is this public relations, PR. I don't mean that in the sense of getting yourself into the Age or the Sydney Morning Herald or something. That's probably unless your patients are all around the entirety of the city, it's probably not really going to help you very much. It's quite a lot of work. But what I mean more is coming up to flu season, you can reach out to the editor of the local leader newspaper, or in the local little magazines, all those little local bits and pieces. I can reach out to them and just to say, hey, do you want to do a quick, I can get you to have a quick interview with one of our doctors about the upcoming flu season, or the changes to the vaccination schedule, or this new vaccination that's becoming available for elderly people, or whatever it is. And then the other thing as well, and like keeping in mind of where do our patients come from, which is a question that you really should be asking on your new patient form. How did you hear about our clinic? But referrals from patients to family and friends is also really a really strong channel, and also one that obviously converts very well if it's a personal recommendation from someone. So don't forget kind of that as well. I'm not saying you need to be paying patients to refer other people. That's maybe a little bit unethical, but keep in mind that is obviously another channel that you're likely to be able to get. So other digital channels that can also be useful, social media is a good one, particularly Facebook. Particularly for a sort of general practice. Facebook is absolutely the first place I would go, and really probably the only place I would worry about. If you're going to worry about any social media, it would be Facebook, unless you really desperately want to get your medical practice on Snapchat, but I'm not sure why you'd do that. I actually ran a webinar about that a couple of months back, so I'm not going to go into a lot of detail, but you can run ads on Facebook as well, and they can also be a very good way of. The good part about Facebook ads is you can target very, very specific locations, so you can target people just in your suburb within a certain age range, who are male. So you can do very, very specific targeting with Facebook, which can be very useful for this kind of thing at times. But, as I said, head to the other webinar, and you'll be able to find more information about that, as well as some pieces on ARPA compliance, which is, of course, everyone's favourite thing. So that was all I really wanted to cover today. I hope I haven't, really totally made your head spin. The slides will be available, and those resources I mentioned are quite good. You're welcome to shoot me an email with any questions. My email's on the thing there. If you are a HotDoc Bookings customer and you just want someone to have a quick look and check that you've got everything set up all right, just drop an email to support, and we'll make sure that your customer success manager has a quick look for you. But we're happy to help in whatever way. While we don't obviously build websites for you, we're certainly happy to help as far as how HotDoc is configured, and if you've to make sure that you've configured it in the best way possible for your practice. So if anyone has any questions, you're welcome to drop them into that question box, and I'll stick around and answer a few questions, or if you want to go back and have a think and come back at another time, you're welcome to shoot me an email. As I said at the start, the recording will be up later this week or early next week, as well as the resources that I mentioned. I'll just link them there, as well as they're obviously linked in the slides themselves. But thank you all for attending. Magali will be running the next webinar again next month. I can't remember the topic that she's chosen, but I'll make sure I mention that in the email that you'll get probably later this week or early next from her.